I'm Paul Crowther. I'm the Chief Constable of the British Transport Police. I'm a National Police Chiefs Council lead for suicide prevention and bereavement care, which works alongside the mental health portfolio to help protect vulnerable people in our communities. Well, suicide is a significant issue within the communities that we serve because of the substantial impact that it has, not just obviously on the person involved, but also the much wider impact on friends and family and the wider community when a suicide is completed or indeed someone attempts it. So it's really important that the police play their role alongside others to help minimise those impacts on our communities. Well, the impact is far-reaching. The cost of a suicide on every occasion is around £1.4 million. That's in direct costs, also the demands on services, and of course the loss of that person to society and the economy at large. But of course this is primarily about people and the loss of life, and that's why it's really, really important that the police play an active role in helping those charged with statutory responsibilities to support vulnerable people and prevent these occurrences where we can. At a tactical level, officers and police staff will come across people who are at risk of suicide in their everyday duties, whether that's a call handler in a control room or an officer attending an incident where they assess the risk. But strategically, we have an important part to play in supporting this as a government priority, who set out the statutory responsibilities on local authorities and healthcare professionals to protect people from self-harm and from suicide. And the police have a really important role to help and coordinate some of that activity. There are many ways that police officers and police staff can help to prevent suicide within our communities in our everyday work. That can be by targeting locations that are known for this type of activity, for looking at people who are vulnerable because they fit within particular characteristics or risk areas. For example, those who've been arrested in relation to child sexual exploitation are known to be specifically at risk if proper care plans are not put in place. So there are a range of opportunities for us to intervene and play a really strong part, whether that is the early identification and the passage of information to other agencies, or direct action that we can take with family members and others who are at risk. Through the development of this authorised professional practice, the Suicide Prevention Working Group are keen that we provide a toolkit for officers that they can use as a reference point to help them in this vitally important duty, to enable them to identify those who are at risk, to identify good practice, and to identify opportunities to bring in other professionals who have got the real ability to provide care and support to people who are most at risk. So it's a really important part of operational practice that we need to share and embed across the service.